Hi everyone, I'm back with you again today to talk about diabetes this time and how to not only prevent it but manage it with diet, and of course, as always, with the Mediterranean diet spin on there, and how we might adapt the Mediterranean diet to suit our management and prevention of diabetes. So firstly, let's set the scene. Let's remind ourselves what's actually happening in type 1 and type 2 diabetes, slightly different. So in type 2 diabetes, your pancreas is actually producing and releasing insulin. There's just a disconnect, so it's not actually doing the job that it needs to be doing. Whereas in type 1 diabetes, your pancreas isn't releasing insulin at all. So what we'll talk about today will be applicable for both type 1 and type 2, except for those with type 1 might need to just take a bit more of a carb counting approach, so a little bit more specific than those with type 2 may have to do, but still all the while very useful. So there is so much research supporting the Mediterranean diet and an authentic Mediterranean diet in the prevention and management of diabetes. There's research that tells us that it decreases our insulin resistance, it decreases our fasting blood sugar levels, and also our HbA1c, which represents our longer term management of our blood sugar levels. And then not only that, but of course the Mediterranean diet is a key weight management strategy as well. And we know that weight or excess weight is a key risk factor in the development and the management of diabetes. So it's a win-win in both situations, which is good. So firstly, let's refresh on what are our carbohydrate foods. Okay, so not forgetting that it's not just our simple sugars and the simple sugars we think of like lollies and chocolates and soft drinks and such. It takes into consideration a lot of our naturally occurring sugars as well. So let's revise them. So we've got our whole grains, which is your bread, pasta, rice, muffins, cereals, crackers, things like that. Our starchy veggies, so this includes our sweet potato, corn. This also incorporates legumes and lentils. They are a carbohydrate as well. Dairy is also a carbohydrate, including specifically milks and yogurts. Some cheese are higher carb than others. The harder the cheese, the lower the carb typically. Then you've got fruit of any format, so whether it's fresh, dried, tinned, canned, like anything, that is all forms of sugar, and obviously there's better forms than others. So as you can imagine, we don't want to cut all of those out because we don't have much left when that happens. So the key is not thinking about carbs as our enemy in this situation. What we need to be mindful of is the quantity, of course, the quality, and also the distribution across the day. When are we having them? The timing of them is also really important. So we need to balance all of the above. So lucky for us, the Mediterranean diet does include all of the above that I just mentioned, but what the best part about it is it's low GI. So glycemic index talks about the quality of carbs, not necessarily the quantity of carbs. So as a refresher, lots of refreshers in this video, the glycemic index tells us how fast or how slow our carbohydrate is being broken down into sugar molecules and how fast or how slow it's being released into the blood. We want that process to be as slow as possible because that keeps us fuller for longer and it stabilizes our blood sugar levels across the day. It stops us from experiencing that roller coaster. If we were to graph our blood sugars, we don't want the highs and the lows. We want stability across the day because that influences our hunger, our mood, irritability, our energy levels, appetite. So it's in our best interest to be following a low GI diet, which the Mediterranean diet is. So that is one of our first steps of making swaps from high GI food sources to low GI. So you start with swapping white bread to either a sourdough or a wholemeal bread, swapping white potato to sweet potato. All legumes are low GI, so including them 3 times a week. Making sure that your fruit is fresh instead of dried, tinned, or juiced. And that's just a few. There's a lot of low GI options like crackers, making sure that they are whole grain based. Okay, so a typical one is saladas to Vita Wheat or something with a bit more fiber in it. So that controls our quality of our carb. Let's touch on the carbohydrate quantities in the Mediterranean diet. So as far as starchy veggies go, so including sweet potato, 1 to 3 times a week is recommended. So for those who are looking to manage their blood sugars, you might aim for the lower end of that range. Whole grains, again, it's a wide range, 2 to 8 serves a day. But if we're looking at blood sugars, aim for the lower end of that range as well. So you might go 2 to 4 rather than 2 to 8. With your dairy, we recommend 2 serves of dairy a day. Just be mindful that flavored yogurts are going to have excess sugar in there naturally. And then also, if you are using dairy alternatives, be mindful that something like an almond milk will be lower GI than something like an oat milk or a rice milk. So there's a couple of extra swaps there to be made. Then 2 fruit a day, okay? And like I said earlier, sticking to fresh fruit as our source. Lastly, to finish off, look at your distribution across the day. So the timing of your carbs. Are they equal? Are we sort of stabilizing across the day? Or again, are we having a carb heavy top or a carb heavy dinner and nothing in the middle? That's going to showcase a roller coaster. Again, like I mentioned earlier, something we want to avoid. There's a few aspects. Remember, quantity, quality, and timing. They are not the enemy. Carbs, we need them in the diet. We've just got to manage them. Okay, so overall, the balance is key as always. Avoid severe restriction and look towards a more sustainable way of managing your diabetes. And I'm sure I'll speak to you all again very soon. Have a good day.